Today we'll explore the fundamentals and pillars of precision medicine. Let's start with an overview of the ongoing transformation in the healthcare sector. Healthcare is undergoing a profound transformation, an evolution of its traditional model. We're moving beyond the approach of the past. Also known as one-size-fits-all, this is an approach based on generalized treatment that is applied to everyone with a similar disease and symptoms. However, the one-size-fits-all approach doesn't take individual biological variability into account. Think, for example, of the standard dosage of a medication that's prescribed to everyone. All adults, regardless of their genetic metabolism, but only based on the person's weight. Obviously, this wouldn't achieve the desired result for all patients. Even though it's logistically efficient and works well for a large part of the population, it will be ineffective for some and cause unwanted side effects. And for others, those side effects can even be severe. It's even harder to make the right therapeutic choices when the cases aren't so numerous and treatments are done by trial and error. In this context, precision medicine emerges as a new paradigm, a new system that recognizes and leverages each patient's biological individuality to provide the most appropriate treatment at the right time. This isn't just a simple technological upgrade, but a structural change in medicine itself. This change is redefining prevention, diagnosis, therapy, and even the relationship between doctor and patient. The goal is no longer just to treat the disease, but to prevent it and, if it does occur, to treat it in the most targeted and least invasive way possible. Clinical and symptomatic observations, while still valid and useful, are no longer enough on their own. Instead, it's necessary to gather new data and treat the disease based on each individual's unique profile. Big data in precision medicine mainly concerns genomic or omic data and clinical data. Genomic data includes those coming from genetics, but also all other omic data, such as those derived from proteomics, metabolomics, transcriptomics, and epigenomics experiments. These experiments provide critical insights into an individual's genetic makeup and disease mechanisms, which are essential for new discoveries. These range from identifying therapeutic targets to predicting drug response. An equally fundamental component is clinical data obtained from electronic health records. In this regard, digital literacy within clinical facilities is crucial. Properly collected, this data is fundamental and includes detailed information on diagnoses, treatments, test results, and medical history, supporting patient stratification and therapy selection. Although genomic data and electronic health records are the cornerstones, big data extends to a wide range of multimodal sources, including biomedical imaging data, behavioral data, environmental and social factors, and real-time monitoring data coming from sensors or wearable devices. Integrating this dataset from multiple domains is essential for more accurate diagnoses, prevention, treatment, and personalized interventions, going beyond genetics alone to adopt a holistic view of the patient's health status. The current relevance of precision medicine is the result of a perfect storm of technological, economic, and social factors, which have emerged almost simultaneously. The main driver of this change has been the exponential decrease in the costs and time required to sequence the human genome, significantly outpacing the rate of progress predicted by the famous Moore's law for microchips. It all started with the Human Genome Project, launched in the 1990s, which laid the first stone for precision medicine. At the time, the Human Genome Project might have seemed like a crazy undertaking. Yet the effort, spread across various countries, led by the United States and the United Kingdom, paid off, finishing a few years ahead of schedule and triggering a dramatic drop in costs. To put things in economic perspective, sequencing the first human genome. In 2000, it cost about $3 billion and took 10 years. Nowadays, the cost is around $300 per 30x genome. That means we read every base, every A, C, G, and T that makes up an individual's genome 30 times for just $300. This dramatic drop in costs isn't just a technical factor, but it was the causal catalyst that made precision medicine economically and logistically sustainable, turning a scientific promise into a clinical reality. On top of this cost reduction, advances in computer science have made it possible to manage huge volumes of data, big data, actually. It was necessary to create new computational infrastructures, like cloud computing, to support research, clinical practice, and the development of formats to ensure sustainability. But just how big is big data? Big data is measured in the order of petabytes or exabytes, that is, 1,000 or a million 1 terabyte disks, respectively. The need to manage and move such large volumes of data has driven the development of specialized formats, like SArray-Lite, a format that optimizes the storage of raw sequencing data. There is also growing economic pressure on healthcare systems, pushing the search for more effective and efficient solutions to manage data. Last but not least, we're starting to see greater public acceptance of the usefulness of data collection practices and the use of molecular data as people recognize the potential benefits. Now that we've acknowledged the major forces at play, let's return to precision medicine. We can say that precision medicine aims to prevent and treat individuals as effectively as possible. To understand this concept, it's helpful to use the metaphor of an architectural blueprint for a building. The human genome is the unique blueprint for each person. 6 billion ACHTs that contain all the instructions to build every type of cell and molecule needed for life. In this context, harmful genetic variants are like structural weak points that, under certain circumstances, can lead to disease. However, it's essential not to fall into genetic determinism. In fact, genetics accounts for only 16% of a person's average lifespan. The rest largely depends on lifestyle and environment. This data has a profound implication. It justifies the focus of precision medicine not only on diagnosis, but also on proactive prevention and integration of environmental and lifestyle factors for a holistic view of the patient. The success of the precision approach requires subtyping diseases by grouping together different types of data, such as identifying tumor subgroups, each with a specific molecular signature that responds to a targeted different therapy, even if they appear clinically similar. In conclusion, if we have to distill the essence of precision medicine, we can say that it represents an evolution in medical thinking, recognizing that the most effective treatment cannot be the same for everyone. The main driver of this change is the technological boom of recent decades, which has enabled the accumulation and use of data. The incredible development of omics techniques, together with the drop in sequencing costs, has made it feasible to apply an approach based on biological individuality. We have, therefore, moved from treating general diseases to treating the specific patient with a specific condition.